Spent my entire career managing patients with hemophilia. Hemophilia A is the most common inherited bleeding disorder. It affects about 1 in 5,000 males, but females can rarely be affected as well. What happens in hemophilia A is they are missing a single blood clotting factor, factor VIII. And so in order to treat these patients, we give a replacement of factor VIII to help restore their blood clotting. Without factor VIII, in the severest forms, patients are at risk for significant bleeding, primarily into joints, but other life-threatening bleeds as well. And if bleeds were allowed to occur from childhood into adulthood, this results in a severe, debilitating hemophilic arthropathy in later years. So prophylactic replacement therapy has been the foundational goal for treatment for severe hemophilia A. So if we can replace that factor VIII, we can restore hemostasis. Now, to do that, it's a pretty significant burden that families have to take on. With the available factor concentrates that we have, patients often are having to give an intravenous infusion multiple times per week. And even there, they're basically going through peaks and troughs in their blood levels. And even during these trough phases, they may spend a considerable amount of time where they remain at risk for bleeding. So in the last few years, we've been looking for bioengineering innovations on the recombinant factor VIII platform to take us to new tiers of protection for patients with hemophilia. And this new molecule, efanesoctocog alfa, or BIVO01, looks to have really significant properties here that I think is going to benefit this patient population. Yeah, so the breakthrough status, this is really significant. We've never had a factor VIII product that's come to market that's received a breakthrough therapy designation from the FDA. So this is based on the novelty of this this bioengineered recombinant factor VIII, but primarily on what it's able to achieve in patients who receive this molecule. So this investigational factor VIII therapy gives high sustained factor activity levels that are in the normal to near normal range for the majority of a week if patients are dosing on a once weekly schedule. So if you think compared to what I just told you about what we've been used to seeing with factor VIII replacement, multiple IV infusions a week, peaks and troughs down at levels where patients often remain at risk for bleeding, I think this really does offer a breakthrough of improved outcomes for patients. There's no question. The priority review for BIVO01 was based on the pivotal data that came from what's called the Extend-1 phase 3 study. And that study met primary and secondary endpoints. What this study looked at was prophylactic treatment in patients with hemophilia A who were dosed at once weekly dosing with this product. And what was remarkable is based on the enhanced pharmacokinetics with this engineered molecule, after a weekly dose, they would spend most of the week in the normal range, or at least near normal, and that was accompanied by clinically meaningful improved protection from bleeding. Now, we had opportunity in this trial to look at patients' experience when they were on their previous prophylactic therapy with existing commercial factor VIII products and compare it to their bleed protection with BIVO01. And they had significantly improved reduction in their what's called the annualized bleed rate compared to their prior prophylaxis.